I have sanitized my hands, washed and sanitized my hands, and gloved up. I'm preparing for a pediatric assessment on baby girl Kenny. I checked her chart and she was born of a natural vaginal delivery. Her APGAR scores were 7 at 1 minute and 9 at 5 minutes. And the first thing I plan on doing is doing her vital signs, which will include her respirations, pulse, and temperature. So I'm going to slightly uncover her and start with an axillary temperature. Actually, I'm not going to do the axillary temperature first. Correct myself. I am going to do her respirations first. And we are going to count those respirations for a full minute. She has 40 respirations. Now I'm going to check her apical heart rate. That will also be done for a full minute. Heart rate is 140 beats per minute. Now I will take an axillary temperature. Temperature is 98.6 degrees. All vital signs are within normal range. Now we are going to move her blanket out of the way so that we can do her length, her weight. So I'm going to place her over here on the scale. She weighs 7 pounds, 7 ounces. Now we are going to measure her length. And she is 19 inches long from toe to head. And we are going to measure her head circumference. And that is 14 inches. We're going to move and do chest circumference now. That is 12 inches. I'm going to get her blanket back over here, so if she should get cold, we can make her comfortable again. Now we are going to look at her body and see if it is aligned. Her body is aligned and symmetrical. Muscle tone is good, flexed. Oh, sorry, baby girl, don't cry. Don't cry. Her cry is strong. Skin is pink. There is the presence of vernix secosa in her skin folds. There is also minute amounts of lanugo on the shoulders and upper back. Excuse me. There are normal variations of milia across the bridge of her nose. There is some normal variations of erythema toxicum. There is no present petechiae. Let's roll you over. She has 2 Mongolian spots on her upper buttocks here. Now we are going to the head, and I am going to palpate the sutures, and they are palpable with small separations. The posterior fontanelle is triangular shape. The anterior fontanelle is diamond shaped. There's no caput pseudoneum, no cephalhematoma present, no molding. She has this perfect little round head. We are going to go to her face now. The face is symmetrical in appearance and movement. Her eyes are symmetrical with her face. Her irises are blue. Perla is sluggish, and reaction is not yet present. Strabismus is present. Let me check your eyes, little one. Conjunctiva is clear, thin, and transparent. Her ears are well formed and in alignment with her eyes, the outside corner of her eyes, that is. Her nose, both nares are patent bilaterally. Her mouth, now we will move to her mouth, which I will check with a gloved finger. I'm going to check the palate first. Palate has no holes or openings. Looking in her mouth, there's no Epstein pearls present. Her suck and swallow reflex, I checked earlier as witnessed when she was feeding with mom earlier. Now we will move to the neck and the clavicle area. See if you can see my baby. Neck and clavicle area. She does have a small neck, and I'm going to palpate the clavicle area. The clavicle area is palpable. Appear to have no openings present. There's no crepitus present. Her chest is cylinder shaped and symmetrical. Nipples are located appropriately and not engorged or any discharge. I'm going to check her breath sounds. Breath sounds are present and clear bilaterally. There was no evidence of murmurs present. Her abdomen is round and soft. Vowel sounds are present. Hey, baby girl. Moving right along. Umbilical cord has 2 arteries and 1 vein present. As evidenced by previous diaper change, her bowel patterns are she is urinating and having BMs regularly and normal. They are normal patterns. Her genitalia is appropriate. There's no discharge or bleeding. Labia is covering the clitoris. Get her diaper back on. Excuse me. Her extremities are equal and bilaterally symmetrical. She has equal bilateral movement in her upper and lower extremities. She has good muscle tone, hip range of motion is good in both hips. Feet have normal positioning, no abnormalities in the feet. Now I'm going to roll you over, baby girl. We are going to check your back and your spine. I'm going to palpate her spine. It is in alignment. There's no openings felt in the spine. I'm going to check her anus. Her anus is patent. Roll you back over. Now we're going to do some little exercises. We are going to move to the part now where we check her reflexes. Her Moro reflex is normal, both left and right. When cheek is stroked, she moves face to both sides. Her tonic neck is present from side to side. I'm going to check her palmar and her plantar flexus now. Aww. She curls her fingers around my thumbs. You grip her feet. She curls her toes around the thumbs. Her sucking reflex is present. I already did that one. Moro reflex. Sorry guys, I did the Moro reflex and called it the sucking. Moro reflexes, we're gonna pull baby up. Head goes back a few, like 30 degrees. And that looks good. Let's see, we are going to do sucking and swallowing reflexes. We talked about earlier when we did the mouth assessment. That was witnessed with mother and baby earlier, as noted when she was feeding. Stepping. Okay, little girl, we're going to stand you up now and see if you can step. When holding her in the stepping position, she lifts one foot and puts it down and the other and puts it down. Now I'm going to stroke her feet on the bottom for the Babinski reflex, up and around. And she is flaring the foot with the big toe way out. And the same with this, with the left foot. Babinski reflex is present. And then we need to check for the gallant or the trunk inconversion. Down the side, ooh, she goes to the side that you run your hand down. That is present. When infant does cry, her cry is strong. This infant appears to be in a quiet, alert state, and I don't see any signs of hypoglycemia, jaundice, respiratory distress, or any signs of infection in this baby. This baby appears to be a very healthy newborn.